All right, let's dive into something really important: acute heart failure. This isn't just a chronic condition. We're talking about a sudden, life threatening event where the heart just stops keeping up. It's a true medical emergency. So let's break down what that really means. I mean, it's a terrifying thought, right? What happens when your heart, the one organ you rely on every single second, suddenly can't do its job? This isn't always a slow fade, it can be a sudden crisis. So, what is actually going on inside your body when this emergency strikes? Okay, so let's get down to the official definition. Basically, it's when things go from bad to worse fast. The heart's function takes a nosedive and it throws your whole body into chaos. This is absolutely a get to the hospital now situation. No waiting around, it's a full-blown emergency. So, to really understand this, we're going to walk through the whole journey, step by step. First, what is the crisis? Then, how do you spot the warning signs? What do doctors do to figure it out? How do they turn the tide? And finally, what does life look like after the crisis? All right, let's start at the beginning. The crisis itself. What is fundamentally going wrong inside the body when the pump starts to falter? Okay, the easiest way to think about your heart is as this incredible, powerful pump, nonstop 24/7. But in acute heart failure, that pump suddenly gets overwhelmed. It just can't meet the body's demands. Maybe it can't squeeze hard enough, or maybe it can't fill up with enough blood between beats. Either way, the result is the same: a serious drop in what's called cardiac output. Basically, not enough blood is getting where it needs to go. And make no mistake, this is not some rare condition. We're talking about huge numbers here. Just in the UK, about 900,000 people are living with heart failure. That's a lot of people. And every single one of them is at risk of this kind of sudden, acute crisis. So this chaos is happening inside. But how does it show up on the outside? Well, your body has its own alarm system. And honestly, knowing how to read these signals can literally save a life. Yeah, these aren't subtle little hints. These are big, flashing red lights. That sudden breathlessness, that's the failing pump causing fluid to actually back up into the lungs. The swelling in the ankles, same problem, different location, fluid is building up all over. And that bone-deep fatigue, well, that's what happens when your muscles and organs are starved for oxygen. It's all connected back to that pump. Recognizing these alarms is absolutely critical. Okay, so someone recognizes the signs and gets to the hospital. Now, the clock is ticking. For the doctors, it's an absolute race against time. They have to play detective, and fast, to figure out exactly what's going on and get the right treatment started. Luckily, they have a playbook for this. It starts with a physical exam, listening to the heart, the lungs, but then comes a series of tests, and each one is like another piece of the puzzle, helping them build a complete picture of what's happening with the heart. The very first clue often comes from an ECG. You can think of it as an electrical map of the heart. What are they looking for? Signs of stress, a wonky rhythm, maybe even old damage. And here's the thing. In acute heart failure, that map is almost never normal. It's a huge red flag. All right, clue number 2 is a visual one. Remember that fluid backing into the lungs? A chest x-ray lets doctors see it plain as day. They're looking for something called pulmonary edema. Basically, those areas on the x-ray that should be nice and clear are instead cloudy and white. It's a classic, textbook sign of acute heart failure. So once they've confirmed it's heart failure, the next big question is, what kind of heart failure is it? To figure that out, they measure something with a bit of a long name: the left ventricular ejection fraction, or just LVEF for short. All it is really is a percentage that tells you how well the heart is squeezing blood out with every single beat. And this number, this LVEF score, is a huge deal because the treatment depends on it. If the score is low, say 40% or less, that's what we call heart failure with reduced ejection fraction, or HFrEF. Think of it as a squeeze problem. The pump is just too weak. But, and this is so important to get, you can have heart failure with a normal score. That's called heart failure with preserved ejection fraction, or HFpF. In that case, it's not a squeeze problem, it's a fill problem. The muscle is so stiff it can't relax enough to fill with blood properly. Two different problems, two different approaches. Okay, diagnosis is in. The detective work is done. Now it's all about action. How do the medical teams turn the tide and pull someone back from the brink? Right away in that critical phase, the goals are super clear and super urgent. Number 1, help the person breathe. That's paramount. Number 2, get that extra fluid out of the body to ease the congestion. 3. Get oxygen-rich blood flowing back to the vital organs. And 4. Do everything you can to limit any more damage to the heart and kidneys.
So, how do they do all that? Well, the patient's blood pressure is like a signpost pointing down one of two very different roads. If blood pressure is sky high, the heart is trying to pump against a brick wall, so the goal is to ease that strain. They use drugs to open up the blood vessels and diuretics, you might know them as water pills, to get rid of that excess fluid. But if the blood pressure is dangerously low, that's a state called cardiogenic shock. It's a whole different ballgame. The goal is to prop up the system with powerful drugs that support the heart and keep the blood circulating.
Getting the patient stable in the hospital is a massive win, but it's really just the beginning of the story. The real work, the long-term journey, starts when they go home. It's all about managing the condition and, crucially, preventing another crisis.
And this is where we come back to that all-important LVES score, because the long-term game plan is completely different depending on the type of heart failure. It's not one size fits all. It's totally tailored to whether you have a squeeze problem or a fill problem.
Now, for people with HFrEF, that's the weak pump, the squeeze problem, there's what doctors call the 4 pillars of medication. And these aren't just for symptoms. They actually change the course of the disease. Some of them work by giving the heart a break, slowing it down and reducing strain so it can heal. Others actually help the heart muscle remodel itself and get stronger. It's an amazing combination that has been a total game changer for extending and improving people's lives.
And you can't do this alone. Managing heart failure is 100% a team sport. Having a specialist heart failure team in your corner makes a huge difference in outcomes. And one of the most critical plays is that first follow-up appointment. It has to happen within 2 weeks of leaving the hospital. It's that important for making sure everything's on the right track. And this really gets to the heart of it all. Modern heart failure treatment isn't just about keeping someone alive. It's about so much more. It's about getting back to a good quality of life, living fully, and having the right plan in place to stop the next crisis from happening. It's a way more proactive and, frankly, a much more hopeful way of looking at things. So we've walked through the whole journey, from the first warning signs to the diagnosis and the path to recovery. It kind of leaves us with one big question, doesn't it? Now that we know all this, how can we better support all those people living with this risk? And maybe, just maybe, how can we use this knowledge to stop the next crisis before it even starts?